what are some treatments that you could do for vaginal and pelvic health?
When I think about GSM, right, which we just talked about, so I always think about, okay, the one that is the most simple, straightforward, easiest is vaginal estrogen because that doesn't enter your, like, it has not been shown to enter your bloodstream in significant amounts. It really acts locally in the tissue and the vaginal area. So it's a very low dose, but it tends to really work on the directly on the tissue. So it helps with creating it to a more elastic vagina, so the pain that you experience because of dryness, it improves that. It also improves, just bladder health so that you're reducing your risk of UTIs, and some of the symptoms like, earlier onset incontinence. And it also, helps, again, as I said, it helps really try to resensitize, the tissue, the clitoris, all the external tissue. So I don't tell my patients just to insert it vaginally. I tell them to apply it externally as well to all the tissue so that, your labia, your clitoris, they all benefit from that. And then, there are also there's DHEA. So it's a supplement that you can insert vaginally. And DHEA breaks down to testosterone and estrogen. Some of those testosterone receptors also help with, improving your, just sexual health along with estrogen. But it's like the DHEA is a little easier because you just insert the suppository at night and then it just absorbs. You can use lubricants and moisturizers. Those are options as well for GSM. Again, it's not treating the root cause of what's happening, but it may help. Sometimes you get to a point where if GSM has been allowed to continue for years and years, lubricants and moisturizers may not help. And then, when I think about pelvic floor physical therapy, a lot of women aren't aware that there's pelvic floor physical therapy, and that still will help try to bring more blood flow, oxygen to those tissues so that they can really rebuild, vaginal tissue. So that's physical therapy with a trained.
But if you're not having sex a lot and you're not using your vagina, does that also affect the dryness and the tissue?
Yeah. So, I mean, you may have, because some women, dryness manifests as itching and irritation, and they just start itchy, itchy, itchy. And it's because the tissue has thinned out. So, even if you're not having sex, say that, you may be having other symptoms. There are a lot of things that can occur. So, that's why I'm saying it's not just for sex, it's your health, it's your vaginal